Sugar Talk with Dr. K. Lucas. Doctor's in the house. Good morning, doctor. How are you?
Good morning, I'm good.
And what are we talking about today?
We're doing our three-part series on questions from diabetes school.
Okay, yeah. Now you recently had a diabetes school. You got another one coming up in June, and each one you elicited questions from the audience. And this time somebody wrote them down.
Somebody wrote it. We had like 75 questions,
Oh, wow.
surprisingly.
Wow. All right. Well, let's get started into this one. Does this one have a kind of a category to it?
Well, I'm talking about complications of diabetes and for this one, because there were a lot of questions about that.
Okay. If my glasses prescription changes a lot, how do I know it's from diabetes or my eyes are just getting worse because I'm getting older?
Well, I think if you can't, if your arms aren't long enough and you can't read some small print, that's probably from getting older, because that's pretty definite type change. But a sudden change of prescription, and a lot of the eye doctors now are checking people's blood sugar, because if it changes a lot in a short period of time, that may be a sign of diabetes. And it's not because it's a permanent damage. What happens is the sugar being high gets in the lens of the eye. And it swells up the lens, and if you've ever put on anybody else's glasses,
Right.
it's hard to see most of the time. Most of the time it's harder to see out of somebody else's prescription. So if your lens changes in your eye, then you're not focusing as well as you were before, and that's sort of a sudden change. And it's a lot of a change. So when you go to the eye doctor and you've changed a lot in your prescription, they may need to check your blood sugar.
Is it okay for diabetics to just see a regular optometrist, or should they be seeing an ophthalmologist?
I think they can see a regular optometrist unless they have damage to the retina. A lot of the optometrists take pictures of the back of the eye, which is where all the blood vessels are being able to be seen, and they can see any early damage. And usually if there is early damage, you would be referred to an ophthalmologist who might be able to do laser treatments to prevent bleeding in the eye. And that's what you want to do. You want to prevent blindness by preventing the bleeding. Or macular degeneration is another thing associated with diabetes, and that's when you get swelling in the back of your retina and you can't see as well.
Well, one of your questions about macular degeneration involves being diagnosed with that at an early age. Does that mean diabetes as well?
Not necessarily. I mean, macular degeneration is more of a genetic problem, but certainly diabetes is associated with it. And you want to make sure there's nothing else going on.
We probably have made that analogy before, because we've known people who are perhaps older who had diabetes who also had macular degeneration.
It is associated with it, for sure. But it's not the only cause, and you want to look for other reasons too.
All right, what is neuropathy, and how is that related to diabetes? And if people talk about it in their hands and feet, can you get it elsewhere?
Neuropathy is just damage to the nerves. Nerves go throughout your whole body. They go to parts of your body that you don't control, such as your stomach and intestines, bladder. So if you have neuropathy in your feet, that's the most common thing people know about. Is you get the tingling and burning and sharp pains, usually in your feet, because the nerves to the feet are the longest nerves in the body, and they go longer and longer, and they're more apt to get sugar stuck to them. And when the nerves get sugar stuck to them, they don't send out the right signals. They send out the wrong signals, and it might be touch signal they should have sent out, and now they send out pain signal or numb feeling or weird feeling in your feet, and that's sort of common. Hands are less common, but the neuropathy can affect anything, even to the point that it makes your heart beat faster than normal. It can make your stomach not empty. That's called gastroparesis. When your stomach is paralyzed, basically, it doesn't contract, because the nerves are important for muscles to contract.
Does neuropathy affect your eyes too?
Not really. I think that was a typo.
Okay. But I just wondered, because people have had headaches, if that might be associated with diabetes.
No, the headaches are usually the blood sugar fluctuations.
Okay. All right. Now, if you don't know if you're diabetic or not, if you have issues with that, but you have swelling in your feet, is that perhaps an indication?
No, usually not. I think there's a lot of reasons for swelling in the feet. The most common is just having venous insufficiency or varicose veins or something like that.
Or tight socks.
Or eating at McDonald's and eating too much salt.
Yeah, that's right.
But swelling in the feet, if you have diabetes and you start having swelling in your feet, that's sort of a different issue. If you've not had swelling before and you start getting it, that could be an indication of either kidney damage or heart damage. from diabetes, because the first sign of kidney damage from diabetes is leaking protein in the urine. And if you leak too much protein, you lose proteins out of the bloodstream, and then the blood vessels get leaky and you start having swelling, usually in your feet since you're standing up a lot. Gravity sort of pulls that down. Also, you can have heart disease with heart failure. Heart failure is when your heart doesn't pump out the blood and it backs up, and it may back up into your feet.
Well, and this question is not on your list from the school, but I imagine it's been asked, is there a relationship between gout and diabetes?
The same type of people get both. Diabetes doesn't cause gout, but people that are overweight have a tendency to get gout, and people that are overweight have a tendency to get diabetes. So they're associated in that way. And some of the blood pressure medicines, diuretics, tend to increase the uric acid, and uric acid causes gout. Uric acid collects in the joints. It swells up everything.
And what kind of therapies are there for neuropathy?
There's usually drugs that help the nerves not send out the wrong signals. So that would be like gabapentin, amitriptyline, Cymbalta is used for neuropathy. So there's different ones that are used. There's not a good way of doing it, although controlling the blood sugar helps a lot. And some people notice that their blood sugar, when their feet start tingling, then their blood sugar is a little bit high or a little bit low, or there's a fluctuation in the blood sugar which sets off the tingling. And if you notice that every time you eat, macaroni and cheese, you mentioned earlier, that your feet tingle, you should probably check your blood sugar and see what your blood sugar is, because if it goes way up like 300 and that causes your feet to tingle, then that's not a good thing. You don't want your feet to start tingling, because then if you lose sensation in your feet, you're more prone to injury in the feet, more prone to ulcerations and amputations. So
one of the questions you were asked is, have you ever used light therapy in neuropathy?
Yeah, and I should have looked that up, but I don't know of any light therapy for neuropathy. I think anything that helps it, sometimes even just wearing socks at night, because if you get off your feet at night, you're laying down in a bed, the pressure's off your feet and the nerves just go wild. So sometimes at night, even just putting socks on, there was one person who kept their shoes on at night, and that helped because it put pressure against her feet and it helped the neuropathy. But usually neuropathy seems worse at night. Maybe it's because you're more aware of it, you're not doing anything, but you're also off your feet. There's no pressure on your feet and the nerves send out different signals when there's pressure off of it.
Okay, we're asking questions from the diabetes school held recently in Swansboro. Then you've got one coming up in June 9th at the Flame Banquet Center. You can go online at lucasresearch.org to find out more about that and to sign up. And you can also check in on the studies that are being offered too through Lucas Research. Go to lucasresearch.org or give them a call at 252-222-5700. We'll have more of these questions coming up in a moment. And welcome back to Sugar Talk with Dr. KG and Lucas from Lucas Research. If you have a question, you can call us at 800-818-2255, 247-728-353-4674. But we're reviewing the questions asked from a recent diabetes school, which is free to you, too. The next one coming up on June 9th. Go online to lucasresearch.org to find out more details. Doctor, you mentioned gastroparesis before. One of the questions asked, how do you diagnose gastroparesis? Is it a blood test? And what is the green egg? Why are we talking about it?
Well, gastroparesis is just delayed emptying of the stomach, so the food sits in there a long time. A normal stomach's going to empty in a couple of hours. This may take as long as a whole day to empty the contents of your stomach, and the blood sugar doesn't go up until the contents of the stomach are into the intestines and you start absorbing your food, so it can create issues with diabetes treatment. But it's diagnosed by gastric emptying studies. So there's two types of gastric emptying studies. One is a nuclear medicine study, which you go to the hospital and you eat a radioactive egg. So that's the radioactive egg you eat, and they measure the counts from the radioactivity in your stomach over 2 hours. And they say 50% is supposed to empty in 2 hours, and if it takes longer to empty than that, then it's abnormal. The green egg test is an algae-based gastric emptying study. They put the algae in the eggs, so the eggs look a little green, and that's green the study we do. That's the study we do in the gastroparesis study that we do in our office. So you eat this. I think it's a little salty, but I've never tasted it. But it's eggs and crackers. You get crackers, not ham.
When you have gastroparesis and your stomach isn't emptying, are you not hungry as well?
Yeah, you don't get hungry at all, which may be a good thing.
I was going to say, some people may wish.
I mean, some drugs like Victoza make your stomach not empty as fast, so that you don't feel as hungry. But over time, it leads to a lot of problems. It leads to a lot of indigestion, abdominal discomfort. Sometimes your bowels don't empty as well. You're more constipated. Sometimes you even have diarrhea also, which is from diabetes.
Okay, if you want to ask your questions about diabetes too, you can call on the folks at Lucas Research. Give them a call at 222-5700 and look up the latest research studies that are out there too, and also sign up for the next diabetes school coming up on June 9th at the Flame Banquet Center in New Bern. And we'll see you next